Welcome. Today we're going to do a tour of the maternity unit at the University Hospital of Northern British Columbia. If you've arrived at the hospital between the hours of 6:30 a.m. and 8:30 p.m., then you're going to come through the front entrance. If you arrive between 8:30 p.m. and 6:30 a.m. through the night, then you're going to come through the emergency room. Once you get up to the doors here at Labor and Delivery, you'll find the phone and you're going to push the maternity button, call in, let them know who you are, and then they're going to let you in from here. So once you arrive in Labor and Delivery, you're going to come up to the nurses station and let them know that you've arrived, and then they're going to direct you from here into an assessment room. So now we're going to go check out an assessment room. So once we're in the assessment room, you'll find that there's a gown on the bed. You can put your stuff over here on this side of the bed, and then this is more of the nurse's side to do any assessing that needs to be done. The bathroom is right here. Back here you're going to find in the wardrobe, you'll find basins in case you've been nauseous, and you'll also find some extra pads. The assessment room is where you're going to get assessed to see if you're ready to stay in the hospital. So at about 5 centimeters dilated, that's when generally we admit into the hospital, but this is also the room where you would come if you needed a non-stress test, and any other kind of late pregnancy check-ins and different things. Early induction stuff can also happen in this room. Basically anything that you're coming to the hospital for that you're not ready to be admitted yet, all happens in one of the assessment rooms. Now, one other thing I want to point out in this room is the lighting. So right now we have all the lights on, but it's also quite nice to just turn off those lights, and you can see that this is actually a much better way for you to be able to relax and stay in the zone. When you get to the hospital in labor, it's really normal for our contractions to space out a little bit. And one of the things that you can do to help pick things back up and help to allow your body to relax and get back into the groove is by changing the lighting and becoming comfortable in your environment. So once you're ready to be admitted, we're going to go from the assessment room, and now we're going to go into a labor room. So once you get into the labor room, you can come in. This is going to be the side that you're going to be able to put your things on. So over here, you're going to find a nice big cupboard where there's lots of space for your stuff. You'll have the bed in this area. This is kind of where you can set up everything here. Over here, you're going to find all the different things that you're going to use throughout your birth. So you've got your towels, face cloths. This is where you're going to find the peri bottles that you're going to use for after you birth. This is where you're also going to find your most awesome hospital underwear, which are wonderful. These are washable, not disposable, so you can go ahead, use them, rinse them out, and then you can use them again. Hospital gowns are also here. Also in the top drawer, you're going to find Kleenex and mouthwash and some of these for cleaning your mouth if needed. And then on the second drawer, you're going to find these sheets, and I'm going to show you some of the things we can do with these afterwards. Right off to the side is also where where the fridge will be. So you're able to put any of your stuff that you need in here as well. So once you come in the room, it's good to get set up and get comfortable so you can continue laboring. There's often a ball you can find here. This can be really wonderful to sit on, maybe even leaned up against the bed. The bed raises up quite a bit, and so it can be really nice to sit on the ball and maybe even lean over the bed like this. Also, if somebody just wants to stay standing, the bed comes up quite a lot, and you can labor leaning over the bed, which is really comfortable as well. The bed coming up nice and high, and then this can be a really comfortable position to just labor over, really being able to be nice and open in the hips, keeping your legs soft, and letting baby come down. So let's have a look at this bed because it does a lot of cool things. So I've already got it nice and high. So we talked about some different positions to labor in, but also to birth in. So one of the things that we can do is putting the back of the bed, it's a little bit groany here, but we put the back of the bed up nice and high, and then mom can be on her knees like this, and then leaning up over the bed like this. So she can be up over like this. That can give mom a really good position to labor in an upright position where her legs are getting a bit of a break, and she's being supported. And that position also works really well to push in. Another thing that we can do is drop the foot of the bed, and that also gives mom a few different options as far as even being able to be on her knees here and leaning over the bed like this, which can also be really comfortable for mom for laboring. Another great tool that we have here is the squatting bar. So the squatting bar gives us a few different options and the ways to use it. One of the ways is if we lower the foot end of the bed, and then mom's gonna plant her feet down here. She can have her bum rested up here and even lay back on the brakes, but then is able to get right up over the bar and squat. And this is a wonderful position to push in where the body is upright. We're using gravity to help us, and it can really open up the pelvis. Another great way to use the squat bar is when mom is sitting in this semi-sitting position, then actually we'll put her feet up on the bar like this. Now, one of the things we can use is that sheet that I showed you earlier from the second drawer over on the side, and we can tie the sheet. Now, this is called the water ski position, and it works so good for moms. So mom's gonna have her feet up here, and then be able to hold onto this and pull at the same time as she pushes. And this is a really great way also to birth. Another great position to push in, which we've talked about before, is a sideline position. So with a sideline position, I also like to tie one of these crib sheets just up to the top of the bed railing here. And then when mom is in her sideline position, having that one leg up, this gives her something, again, to really hang on to and pull on. So in this scenario, mom would be looking towards me and pulling here and laying down. And that's also another really great position to push in. So once you're in the room as well, you also have control over the temperature, and you have a lot of control over the lighting in here. So these are the exam lights, which gives a lot of bright light right above the bed, but there's also some dimming lights as well. So one of the things I want to show you is the difference between how the room can look when we have the full lights on and how we can create our own environment, which will be much better for birthing by adjusting lighting. The bathroom is a great place to labor. Every room has a really great tub. They're nice and deep, and they actually have jets in them as well, if that's interesting to you. I really encourage in the bathroom that you create a nest. This is a wonderful place for you to change the lighting, put on some music, get into the tub, and really get into your groove in here. So another place we can use the sheet is to tie it just over this bar here, and that's a really, again, laying on your side and being able to hang on to it and pull it can work really lovely. And then your partner can just get a chair and sit in here, and like I said, creating a nest. This would be a place where I would say some battery operated candles and some music, even just on your phone, are really, really wonderful tools. So after your baby's born and you've had that first lovely 1 hour of skin-to-skin contact, and now is the time where baby can have a newborn check and have a weight done and everything, and that all happens over here on the Panda Warmer. You're gonna spend about 2 hours on average in this room. This is when you're gonna have time to clean up, you'll be using the bathroom, getting on that nice big fresh pad, and Dad can have some skin to skin as well if that's available. And then you're gonna pack up and be able to move into your next room. And that's the room that you're gonna spend the next 24 hours or 2 to 3 days if you birth by cesarean. This is the baby's bassinet, so baby will be moved to the other room in the bassinet and then sleeps in here as well. So we don't ever carry the baby in the hallway. The baby is always moved in the bassinet in the hallway. This station is located right in the middle of all the labor rooms. So you're gonna find your microwave here if you want to heat up a rice bag or any food. This is also your cups and straws. There's some crackers here. Here's where you get some ice and water if you want to put some ice water in a basin for helping mom for comfort, but also just for drinking. And in the fridge here is where you're going to find your juice. After you've had your baby, this is the room that you're going to spend the remainder of your time in while you're in the hospital. So just like the other rooms, you'll be able to put your stuff over here in the cupboards. You can control the heat the same as you can the temperature, the same as you can in the other rooms. This bed is far more comfortable for moms, which is really nice. We also have a really comfortable chair here for doing skin to skin in and being able to have those really lovely baby cuddles as well. This is going to be the baby change station. So just set up over here, we've got face cloths to use as wipes, then the diapers, some Vaseline, Q-tips for some cord care, and then this is your soap that you can use for baby's first bath as well. In the bathroom, you're going to find your pads, blue pads, and Perry bottle as well. Also, under the sink, you'll see that there's a stool, and that can be really helpful for getting in and out of these nice deep tubs for when you shower after you've had your baby. So thank you so much for joining us on this hospital tour of labor and delivery. I hope that you found it helpful and that by seeing the space ahead of time that it can help you when you transition into this space in labor to really settle in, know that you're being well taken care of, know what's around you and what's available for you, and so that you can really do what needs to be done to have your baby. So happy birthing!